Hey everybody, this is Mike just checking in regarding my progress with the Skyrizi biologic. I posted a video on here around a year ago, and I was almost a year, if not a year, into taking the Skyrizi biologic with completely clear skin. Very happy with the results, minimal side effects, but there is some effects that I'll go into a bit later. Happy to report this is 2 years, 3 months later. I am still completely clear. Um, no plaque psoriasis anywhere, not even on my elbows. Um, it doesn't come back with weather change. It doesn't come back with sun exposure. I can eat and drink whatever I want. Um, we'll say it's a medication that I can't break yet. This is coming from somebody that's been on other biologics. I was able to break a few listed here: Enbrel, Humira, Stelara. What was the other one? Cosentyx, that one as well. Methotrexate, which is a pill, not a biologic like Skyrizi. That stopped working after 6 months. That's also a cancer drug that you have to be really careful with. Um, I failed on all of the psoriasis therapies eventually. Sometimes they would last 6 months, some would even only last 3 months, some would last a year, but they'd always eventually just stop working. And the end result would be the psoriasis coming back, typically worse than it was in the first place, which I believe was a rebound effect with something like this where it's an autoimmune issue. But the good news with this Skyrizi is I'm still clear. So I'm hoping that the results hold. Side effects have still been fairly minimal, but something that I have been experiencing, which could be a systematic response, is the biologics. What I noticed before they all stopped working is I would get withdrawal effects before being injected with them again. So I would notice that inflammation throughout my whole body would come back slowly, like muscle and joint inflammation, other miscellaneous poorly understood side effects. And this is not when I take the biologic. This will be when it was, wearing off, right about to get the next dose. What I'm noticing with Skyrizi now, the past 4 or 5 months, is I'm getting withdrawal effects on it as well. So it's like my skin stays clear, but maybe because I get my Skyrizi shot every 12 weeks, we'll say around the 8 to 9 week mark, it seems like my body's flushing the medication sooner than it should be, or becoming slightly immune to it. And what happens is joint inflammation flares up really bad, which is called psoriatic arthritis when you have psoriasis. Um, I noticed as well blood pressure goes up a bit. Um, so it seems that when you have an issue like this, like, yeah, it's a genetic issue typically, something that runs in your family, but you have to be really careful with your heart and inflammation throughout your whole body at the same time, because when these medications wear off, or say one day you have to stop taking them, then you're going to start to get a lot of your problems back again. It could cause some serious issues. Um, the stuff that I've been experiencing, definitely not from the Skyrizi itself. I can't really blame the biologic for my body rebounding as it wears off. But what I'm going to probably have to do eventually is, if the psoriasis starts coming back before the injections, I may have to get the doctor to reduce the time between doses. Like right now, I'm getting a Skyrizi shot once every 12 weeks, and it's always been that way after you get your loading doses, and that's how it works with other biologics as well. But what they'll do is, if you start breaking out before your next injection, they'll start giving you the shot every 8 weeks. But in my case, which is interesting to note, is, yeah, I feel it wearing off now, but I'm still completely clear. So I don't have a single psoriasis lesion. Um, I'm very happy with the results I'm getting on this biologic. I plan to stay on it, and I'm just praying that it keeps working, because I like my clear skin. A lot of other people with psoriasis, I'm sure, feel the same way. It's hard to go places with it. Some people, the sun helps. Unfortunately, I'm not one of them, and it actually used to make it worse. But I've been enjoying summers at the beach all the time, staying in the sun, I use sunscreen sometimes, but don't really have to worry about breaking out after if I forget to use sunscreen. So I'm very thankful for that. Um, as far as another thing too is, so when you take a biologic or a treatment for psoriasis, it will lower your immune system, and this is a normal process. Me myself, I am getting sick a bit more, and I'll say this in regards to COVID as well. I've probably had it like 15 or 20 times. I am double vaccinated, so I got 2 of the vaccines. The second one did cause a strange inflammatory response and some heart issues afterwards, so I did not get a third vaccine. Kind of drew the line once I saw that in my blood work, and the doctor didn't really know what to say either. But I caught that a bunch of times since it was a thing. I had it once at a severe level when the first variants surfaced in Canada. Ended up in the hospital, almost died from it, ended up with heart damage after, I believe. I'm not quite sure, but I needed heart medication after having COVID in the hospital. But the other, 14, 15, 16 times, it pretty much just feels like a bad cold. One day of a fever, and then a lot of fatigue, a lot of joint inflammation that comes up after it as well. Still clear skin though, so I mean, yeah, the thing with biologics, they always warn you of the risk of having the lower immune system. But somebody like me at my age, 35, I've just been dealing with it. I probably get sick, let's say 6 to 7 times every winter only. I don't get sick in the summer on Skyrizi or any other biologics, I noticed. And during the winter, I just prepare for it. I get sick first, but I get over it just fine. I have needed antibiotics a few times, and I think the few times I did, I was exposed to something in my lungs when I was cleaning like a dirty house. That was just one example there, and I ended up with pneumonia, which, I mean, that could happen to an older person too, or that could happen to a younger person if you breathe in bad air or mold or something unknown inside a dirty house. Then unfortunately, that could happen afterwards. But in my case, I didn't get severely ill when these incidents occurred while on Skyrizi, and I did just get antibiotics, and it killed the pneumonia within couple days actually. So I'm doing okay as far as that stuff goes. I'm not really paranoid about getting sick. I have all my vaccinations and everything. Nothing else is wrong with me in my blood work, except for one thing actually. I was watching a couple of videos about Skyrizi, and some guy mentioned his liver taking some damage. And I will say that my liver tests are kind of on the boundary of showing damage. I do have pretty high liver enzymes, but they aren't high enough to signal going off the medication or any sort of medical emergency. So they're just kind of on the borderline of failing. The doctor's not concerned with it. Nobody's concerned with it. So some of the other videos I saw where some individuals ended up with liver enzymes out the roof. If that does happen when you're on something like Skyrizi or another biologic, they will probably pull you off the medication, unfortunately. Why it happens is the next question. I'm not quite sure myself. I'm assuming some of those people could have been exposed to something with the lower immune system, and maybe it did attack their liver, or it could be the medication building up in the liver and causing it to strain too much. Hard to say, but me myself, I mean, my liver tests are still either barely failing or barely passing. So I mean, this is coming from somebody that still drinks alcohol too. So I mean, if you got a liver test barely passing, you drink alcohol even once in a while, it's probably not going to improve until you quit, unfortunately. So my case, I'm just keeping an eye on it. But other than what I discussed, A+ to Skyrizi, with all the other health issues that I've had in the past, I would say this is the safest and most effective biologic that I've been on. And as I mentioned, I really hope that it keeps working, because with very little side effects to worry about and clear skin, even when it's possibly wearing off before being given another shot, it's a very effective medication, and it could change your life too. I mean, some people, I respect people that want to treat things like psoriasis naturally or other autoimmune disorders, because if you can do that, it's probably the best route to go. There's no risk of cancer, there's no risk of any weird side effects, and you're not taking a medication that's only been on the market 5 to 7 years. So, you know, if you can treat it naturally, yeah, that's a great way to go. But in my case, unfortunately, I've been battling psoriasis for 20 years. I've had other inflammatory problems that have gone hand in hand with it. So, I mean, for somebody like me, I have to have the medication, or it's just going to make my life quality very poor, leading to other issues later on. So, yeah, that's all for now. If you have any questions, you can leave a comment and I can answer any questions for anybody about psoriasis, Skyrizi, or any other biologic. I've been on them all, so I never really did videos on any of the other ones. But Skyrizi, like I said, has been the most effective out of anything I've taken, and it's had the most long-lasting results. So hopefully when I post another update in the next couple months, couple years, I'll still have great results to report back and no adverse events. Good luck to everybody.